Unlock the power of healing from within. Join us on a journey into the realm of nutritional science, where the age-old adage, "You are what you eat," takes on a profound new meaning. In this video, we delve into the captivating potential of dietary strategies to reverse kidney damage and pave the way to renewed health and vitality. Get ready to discover the transformative impact of simple yet potent foods on the extraordinary workhorses of our bodies, our kidneys. The human kidney, that unassuming pair of bean-shaped organs nestled in our lower backs, is a marvel of biological refinement. It filters our blood, balances our electrolytes, and expels waste, all while playing a pivotal role in maintaining our blood pressure. Kidney damage, or chronic kidney disease, CKD, therefore comes with profound implications for our overall health. But rather than resigning ourselves to a life of managing symptoms, can we turn the tide of renal decline with a mere shift in our pantries? Before we explore each of the 13 foods, we must acknowledge that no singular approach can encapsulate the complexities of CKD treatment. The following foods, if incorporated thoughtfully into one's diet, are suggested by some studies and nutritional experts to support kidney health. It is important to consult with healthcare professionals before adopting any new dietary regimen, especially for individuals with pre-existing health concerns. To appreciate the significance of dietary interventions, we must first comprehend CKD's relentless progression. Often, the early stages of CKD are asymptomatic, leaving a staggering number of individuals undiagnosed. Over time, the kidneys decline in function, eventually leading to end-stage renal disease, ESRD, where dialysis or kidney transplantation become necessary for survival. The factors that contribute to CKD are multifaceted, ranging from genetic predispositions to alarming escalations in lifestyle diseases such as diabetes and hypertension. These conditions pose an undue burden on the kidneys, initiating a cascade of inflammation, oxidative stress, and fibrosis that compromises renal function. But what if the nutrients we consume daily could counteract these deleterious processes? This scenario is far from a fantastical notion and has witnessed a surge of scientific research fueling optimism about the role of food in kidney health. A delectable dozen of kidney-supportive foods. 1. Apples, the unsung heroes of kidney protection. Apples, with their thin skin and spectrum of nutritional compounds, are a testament to the adage of whole foods. They are packed with antioxidants, including quercetin, that scavenge free radicals, thereby alleviating oxidative stress on the kidneys. The soluble fiber in apples, pectin, aids in weight management, a crucial factor in CKD health. 2. Berries, tiny titans of hydration and antioxidants. The vibrantly hued berries, blueberries, strawberries, and cranberries are more than just a sweet treat. Their low potassium content makes them a safe addition for those with renal issues. Furthermore, the high water and fiber content assist in maintaining healthy hydration levels, supporting the kidney's formidable task of filtering and excreting waste. 3. Red bell peppers, a verdant vessel of vitamin C and phytonutrients. Red bell peppers, unlike their green counterparts, are a botanical bonanza of nutrients. They host a treasure trove of antioxidants, particularly vitamin C, which is essential for tissue repair. Their low potassium content is another bonus for individuals managing CKD, as it circumvents the risk of hyperkalemia, a dangerous condition characterized by elevated potassium levels. 4. Cabbage, a cruciferous companion for kidney health. Cabbage and other cruciferous vegetables are foils to inflammation thanks to their high levels of sulforaphane. This compound has demonstrated anti-inflammatory properties and may mitigate the progression of CKD. Additionally, cabbage is a potent source of vitamin K, important for clotting and bone health, aspects that can be compromised in advanced CKD. 5. Cauliflower, a versatile vessel for renal improvement. The versatility of cauliflower in the kitchen makes it an accessible addition to any diet. High in vitamin C and vitamin K, this cruciferous veggie also boasts a low potassium level, much to the benefit of kidney patients. Cauliflower's choline content offers further support, promoting health and metabolic balance. 6. Garlic, the pungent of kidney vigilance. Garlic, though diminutive in size, is notable for its outsized benefits for the kidneys. The sulfur compounds in garlic can promote immune function and possess anti-inflammatory properties. However, for those with CKD, it's important to note that garlic is high in potassium and phosphorus, and therefore moderation is key. 7. Onions, the allium allies in detoxification. In a culinary context, onions and garlic are like the dynamic duo of savory sustenance. Rich in flavor, nuts, and sulfur compounds, onions support the kidneys in fending off oxidative stress and eliminating toxins. They are also low in potassium and a great way to add flavor to dishes without sodium. 8. Cranberries, the tart defenders of urinary wellness. Cranberries are renowned for their role in preventing urinary tract infections, UTIs, due to their proanthocyanidin content that discourages bacteria from adhering to the urinary tract. For individuals with CKD who may be more susceptible to UTIs, cranberries offer a naturalistic shield. 9. Egg whites, proteins without the phosphorus. Protein is an essential macronutrient necessary for numerous bodily functions. For those with CKD, managing protein intake becomes a delicate balance as the breakdown products can strain the kidneys. Egg whites present a phosphorus-free source of high-quality protein, making them a favorite protein supplement for CKD patients. 10. Fish, the rejuvenating pass from the sea. Certain species of fish are loaded with heart-healthy omega-3 fatty acids, which have been linked to slowing the progression of kidney damage. Fatty fish like salmon, sardines, and mackerel, consumed in moderation, can provide these beneficial fatty acids without overwhelming the body's phosphorus levels. 11. Olive oil, the monounsaturated masterstroke. Olive oil, a staple of the Mediterranean diet, proffers monounsaturated fats and an array of antioxidants. While it is calorie-dense and should be consumed in moderation, substituting saturated fats with olive oil can be a boon for CKD patients. Its anti-inflammatory nature may help alleviate the chronic inflammation that characterizes CKD. 13. Garlic and onions. These pungent vegetables are known for their antioxidant properties and can be useful in protecting the kidneys from damage caused by oxidative stress. While these foods offer promising potential, their effectiveness in reversing kidney damage is not a foregone conclusion. Each individual's body is a unique conglomerate of genetics, habits, and health status, and what suits one may not benefit another. For those with CKD, it is crucial to be vigilant about the composition of one's diet, particularly concerning sodium, potassium, and phosphorus levels. Consulting a registered dietitian or a nutritionist well-versed in renal nutrition is indispensable, as they can tailor a dietary plan to align with your specific needs. They will consider factors such as your kidney function, medications, and other health conditions and can provide the